In today's video, I will introduce you and show you two posture restoration techniques that will help you to create lower back spinal decompression, yet without applying any stretches whatsoever, but with respect of your proper pelvis and rib cage positions, as well as with respect of your neurology. So, who can get a benefit out of these techniques and principles? So the first group of people are people who have tight muscles, symmetrical type of pain on both sides, tight QLs, tight erector spine, and at times painful latissimus dorsi. The second group of people, these are people who have a lot of discogenic problem caused by improper pelvic position, anterior pelvic tilt, or increased tone of hip flexors of both sides, which ultimately led to these kind of discogenic problems, protrusions, stenosis, herniations. So that is the cause of your pain. You can definitely get a benefit out of these techniques. But when it comes down to discogenic pain treatment, I will do the separate video very soon when I will describe you the treatment protocol, the principles, and how we are applying PRI therapy to help our patients. So as you can see, these are the picture of the man who used to suffer for a lot of left leg pain, left leg sciatica, and after like 3 or 4 months of the coaching with me, he got a lot of improvements. But it's not going to be, I'm not going to include that into this video. You just have to know that discogenic pain can be treated a little bit differently than just these two exercises that I will show you today. Nonetheless, if you are suffering from severe chronic pain, you have pelvis asymmetry, you went through many physical therapists and you want to get help, click the link below and fill out the form, and I can get and check whether you are eligible person for my online physical therapy coaching, or you can visit us in Poland. Now, before I will show you two techniques and exercises, what we are trying to achieve by doing them. So in PRI, what we are trying to do is not to stretch out the muscles, but rather to create the reposition. Reposition of the pelvis creates the decompression of the soft tissues of different structures. You probably already heard the word decompression. It probably is being associated with you hanging on the bar, applying some stretches. It does work. The only problem is that the result never lasts more than 50 to 30 minutes. And once you are on your feet, you are walking, the gravity creates all sorts of previous alignments and your brain starts to use all of the previous patterns of musculature tension. Now we have to code and program new musculature tension and new position of the posture of the pelvis so that when you are just standing loosely, the new positions are just being there and help you to create decompression. So let's imagine these are two vertebrae and in between there is a herniation that goes in that direction backwards. So these are two vertebrae and they both kind of clinching and pinching this disc, and that's why you have a disc herniation in the first place. But if we would be able to achieve repositioning of the pelvis, we would create a different position from both vertebrae. So we would go from this to this, we create here a lot of space which allows to create the decompression, hence to decrease the pain, that was originated from the herniation. Now the same principle applies to the muscle pain. If we are changing the position of the pelvis, it's being less tilted forward, the attachment points of different muscle groups are getting a little bit elongated, which leads to ongoing relaxation of these muscles. So when I'm saying the attachment points of muscles are getting elongated, I mean they're getting further from each other because of the proper postural alignment. So with the instance of the symmetrical QL pain, when you are creating proper postural alignment neurologically, when iliac crest goes further away from their lower ribs, because you've done a lot of therapy and exercising, the attachment points are getting further from each other, hence the muscle is getting a little bit more elongated and less painful and tight. So that's what I'm telling you. You have to change the alignment of your posture from the neurological perspective. So these are the neurological principles of PRI. Now let's jump into the technique. Hopefully they will help you out. So that's going to be pretty primitive movement, yet very effective. Find yourself an elevation. It should be like a table or a bed or a sofa or a chair. And you have to be supported only with your arms. Make sure that both of your knees and both of your elbows are being gently flexed. Now just adopt the position that I'm using as well, and make sure you are digging down with your heels into the floor by activating your hamstrings, and also try to do the posterior pelvic tilt at the same time. You will feel a gentle stretch in your lower back area. By the way, you can do the same type of movement on the floor. It's going to be a little bit more challenging though. But what you have to do is pretty much to adopt the same type of position. Flex gently both of your elbows and knees. If you will step away further with your feet, it's going to be a little bit more challenging. So again, dig down your heels into the floor, elevate the pelvis up, do the posterior pelvic tilt, and feel your hamstrings. Right now, your brain is learning the contact of your heels is being linked with your hamstring activity, which is exactly the neurological event that I'm talking about. When we walk, our brain should associate heel contact with your hamstrings. That's how we can create the reposition on the long-term basis. Now, all you have to do is just maintain that pose and tension for 5 decent breaths. Breathe into your nose, breathe out through your mouth, repeat 5 breaths. When it comes down to this exercise, it's going to be more challenging because it requires from you to have a hooks or straps around your wrists. Basically, you have to hang on the bar, or you have to find something on which you can hang yourself on. And when you are doing this, you have to repeat the same type of principles from the previous video. Just like in the previous video, you have to work with your feet. So find yourself a better leverage and try to pull your heels backwards, or maybe both of your feet backwards. And by doing that, you should definitely feel the activation of your thigh, of your hamstrings. And when you feel that, try to tuck your pelvis, do the posterior pelvic tilt, and try to breathe. Breathe out through your mouth, breathe in through your nose, and when you are breathing, you have to expand your rib cage on the back part of it, because that will provide the inhibition of your muscles, especially latissimus dorsi. So watch closely how my rib cage is getting expanded upon each inhalation. Each time I'm trying to inhale through my nose, my rib cage goes backwards, and that's what I'm trying to achieve each time. And that will provide inhibition of my muscles of my back, and of course, inhibition of my latissimus dorsi overactive muscles. So make sure you're doing 5 decent repetitions, which is 5 decent breaths.